Hello, everybody. Welcome to our Ask the Experts once a month Thursday at 1 p.m. Eastern Standard Time. I am so excited to be here with our expert today, and we're going to be discussing cancer-related cognitive decline, or CRCD. And for this month's Ask the Experts, we'll be answering your common questions about cancer-related cognitive decline, or what we know as chemo brain or chemo fog. We're bringing back our expert, Erica Guardascione from ReVital Cancer Rehab. And I would like to do a brief introduction for her. I'm going to add her onto the stream here so that everybody can see her as well. Hi, how are you today?
Hello, how are you?
Wonderful, thank you. Thanks for joining us.
Happy to be here.
So Erica is a speech-language pathologist at Kessler Institute for Rehabilitation in Saddle Brook, New Jersey, and has a deep interest in cancer-related cognitive decline. She is considered an authority on attention, focus, memory impairments, and rehabilitation strategies. Please join me as I welcome our guest, Erica. And throughout this Ask the Experts, we're going to be doing a combination of questions that we've had prepared, but then also we've had some questions come in from our audience as well. So we're going to address both. And if you have any questions, you can feel free to put them into the chat, and we'll be able to take a look at those as well as we go through. Erica, I believe, can see them, and if not, I can read them off to her as well. So to start us off, Erica, could you start by explaining why we are now calling this CRCD instead of chemo brain or chemo fog, as we've heard so often?
Yeah, absolutely. I think the term chemo brain came about in like the late 80s, early 90s, when it was thought that cognitive impairments were related specific to chemotherapy. So that when any patients were undergoing chemotherapy were noticing something they called chemo brain. The term chemo brain, I think, almost has, like, at this point, a little bit of a negative connotation to it, where most people, they play it off, or you hear caregivers say, oh, it's just your chemo brain, or doctors might say, oh, it's just chemo brain. And it feels like there's no research behind it. There's no actual medical diagnosis. It just sounds sort of subjective. But what we now know through years of research and years of cancer treatment, and people living much longer past going through some of these cancer-related treatments, what we now know is that these cognitive impairments are more multifactorial. So they're not just related to chemotherapy. They're related to some thoughts, the cancer itself causing inflammation, and that inflammation impacting our brain functioning. Radiation can cause cognitive impairments. Some long-term hormone medications like aromatase inhibitors and tamoxifen, they can cause cognitive impairments as well, because they're decreasing estrogen in our bodies, and estrogen is needed for really for brain functioning. So there's many factors that go into what can be causing these cognitive impairments. Also, things like cancer-related fatigue and distress. These are all things that can exacerbate cognition. The other important thing about this term is the term decline, right? So very often these cognitive impairments can be very mild in nature, right? So they're not enough to necessarily be deemed as an impairment. So if I were to give you a thorough objective evaluation, you might just see that some things are falling in the average range. But when we're talking about a change in cognition, so a decline in your cognition, it's still a change, and it's a change enough to really impact your everyday functioning. So that's really why we're moving away from that term chemo brain, and more towards this term cancer-related cognitive decline, or CRCD, that you'll be hearing us call it throughout this presentation.
And it sounds like maybe it might be a little bit different for each individual, depending on kind of what their baseline was.
Absolutely.
And so that kind of leads us into the next question. Could you discuss some of the hallmark symptoms a person may notice?
Yeah, so what we find with research and just in my clinical practice, some of the major points that people complain about the most are things like multitasking. So they'll say, like, I used to be able to do multiple things at the same time when I was cooking. I could cook multiple dishes. I knew where I was leaving off. I could answer emails and talk to my son who's asking me a question at the same time. And now I really can't do more than one thing at a time. I can only do one thing. And it's really frustrating. Word finding is another really common one. So it's like that word is at the tip of your tongue, or in conversation, you're trying to think about a word you want to use and you just can't pull that word out. And then memory is another really big one. So people will often say, I'm noticing trouble with my memory. You know, I'm on the way home from the grocery store and I was supposed to pick up 2 items and I completely forgot. So memory is another one. But very often memory impairments are more related to attention. When we look at more objective testing, that it's harder for our brain to focus on information, or it's harder for our brain to hold on to information. So we start to kind of drop things over time. And that can feel like memory difficulty because you didn't hold on to the information in the first place in order to remember it.
And I think that that touches on so many of the questions that we got from the audience, some of the concerns that they had. And so one of the questions that we got, or one of the thoughts that we got, was, I can't seem to focus. I can't seem to listen to a conversation without zoning off and not listening. I'll be in the middle of a conversation and I forget what I'm talking about. This is not normal. Can you speak to that a little bit?
Yeah, I mean, that is exactly your quotes, or quotes I've heard from many, many individuals that I've worked with cancer-related cognitive decline. So that kind of relates to what I was just talking about, the difference with attention and this concept of working memory. So you're talking about in conversation, it's hard for me to remember where I left off. So our working memory is sort of like our brain's mental blackboard. So how much information we can hold on to at one time. And CRCD can really reduce that capacity. So when you're in conversation and you're trying to think about what you want to say and someone's saying something else, and so you're processing all that information, that capacity can shrink a little bit. So yeah, that's a really common symptoms related to CRCD.
And so it is normal.
It's normal in relation to cancer and its treatment. Yeah, but it wouldn't be, and I think we have some other questions related to
Mhm.
normal aging and things like that. That wouldn't be necessarily linked to normal aging per se,
Right.
but more, yes, definitely related to cancer and its treatment.
Okay. Um, and we do have a couple questions about how soon into their diagnosis and treatment journey do people typically start to see those kinds of side effects?
So what we know is that about 30% of patients before they even start treatment are reporting changes in cognition. So it can happen before you're even starting treatment. And this could be related to, as I mentioned before, the cancer potentially causing inflammation in our brain. So the cytokines, our immune system kind of reacts and causes this inflammation. So it could be related to that. It could be related to the distress of getting this diagnosis, the fatigue that often comes along with cancer itself. So 30% before treatment's even starting. And then during treatment, almost 70%. So that's a really high number. 70% of individuals are reporting changes in their cognition during treatment. And then after treatment, 35% are still reporting cognitive changes months to years after finishing cancer and its treatment. So again, and a lot of these answers are going to be the same in that it's going to be dependent. You know, every brain is different. Every body is different. Everybody has a different cognitive reserve. So cognitive reserve is basically our brain's capacity or development over time. So it can be impacted by things like our education, our occupation, how much brain stimulation we've given our brains over the years. So some people have higher cognitive reserve. So when things happen to their brain, it doesn't impact them as much as maybe somebody else who has a lower cognitive reserve. But the good thing, and we'll talk probably more about this as we go on, is there's ways that you can improve your cognitive reserve over time and continue to improve it so that you may not notice some of these differences. So that's why some people are reporting changes and some people may not be.
That's so interesting that I had never heard that it could even start even before they get into their treatments. That's really interesting. But yes, those are all factors that definitely play a part in it. Makes sense. And I think that you covered, how long might these symptoms last. It depends upon the person and, what type of reserve they had to begin with. And I think that probably a lot of those in our community are thinking the same thing, like, okay, well, maybe when I'm done chemo, this will end. But some of the questions that we had from our audience are, even do any of the medications have an impact on that further? So for example, how about decline from ongoing treatment if they're continued on treatment? So this person said that they're on letrozole and Ibrance for the long haul because they're stage 4. So there is no after treatment for them. So what can they expect?
So unfortunately, yes, the longer you are on treatment, the more treatment you get. So if you've had multiple rounds of chemotherapy, I've worked with some patients who've had, multiple myeloma or blood cancers where they're on chemotherapy for years and years and years and years and years. And yes, their cognitive changes are going to be a little bit more significant than somebody who maybe just had one round of chemotherapy. Also, the two medications you mentioned, so the CDK inhibitors, we're still learning about those and whether or not they have any changes and can cause changes to cognition. Some of these newer drugs, like some of the immunotherapy, some of these targeted therapies, we're still finding out more information about whether or not they can impact cognition. What we do know is they can cross this thing called the blood-brain barrier, which is this protection in our brain so that when things happen like drugs or anything, they can't cross the blood-brain barrier to protect the brain. But these drugs are meant to do that so that they can protect the brain from any like brain metastases and things like that. So they can impact the brain. They can get into the brain, which is good to kill cancer cells, but not so great as far as some of those healthy cells as well. So the jury's still out on some of those medications that are considered newer in the cancer world. And we'll see over time if they have an impact. But yeah, so I do see patients who've had more rounds of chemotherapy or been on and off treatment longer, or maybe who've had any kind of metastases. They are at higher risk for cognitive impairment.
And so a piece of what you were saying there, and tell me if I'm wrong, is it does depend sometimes what treatments or medications an individual might be on and how greatly that impacts them.
Yep, absolutely.
Okay. And could you tell us, for someone that's going through this, how can they tell the difference between what is normal aging and what they might be experiencing as CRCD?
That's a great question. That's a question I get all the time. And I think sometimes things get downplayed by aging. And it's usually by people who aren't going through chemotherapy or haven't had cancer. So I've had a lot of my patients say, when I tell my friends that I'm having these difficulties, they're like, oh, well, I do that too. I have word finding issues. It's just normal aging. It's just normal aging. Well, it's not the same. So if you're noticing that these changes are impacting your functioning, right? So if you're seeing a change in your word finding, if you're seeing a change in your attention and in your focus, this is probably definitely more likely to cancer and its treatment than normal aging. And so if you're, let's say, in your 60s and you have an active lifestyle, you have great cognitive reserve, you're keeping your brain healthy, we're not really seeing significant changes in cognition for people in that age group who are keeping their brain active and healthy. Now, if you're maybe in your 90s, yes, we're more likely to see a change in cognition over time. But yeah, that change in function where it's impacting your day-to-day is not typical in normal aging.
So that does lead us kind of into the next variable for this question. Do we see CRCD in any gender more than the other?
So this is a hard question to answer. More women report changes in cognition. I don't know if that's necessarily true as far as are they having more cognitive impairments because they're women, or is it lifestyle, right? So we know women tend to be multitaskers. They tend to play multiple roles in their lives. They take care of their household, they're working, they might be mothers or grandmothers. So they tend to be multitaskers just in their everyday life. So they may notice these cognitive changes more, and they may be more likely to report these cognitive changes where men may not. We are seeing it definitely with men and women, but as I mentioned before, it just seems to be more women are reporting these cognitive changes.
So now some of the questions are kind of turning into, is there anything that people can do about this? Is there anything they can do to help themselves?
Yeah, absolutely. So as we had mentioned before, this concept of cognitive reserve, which really is a newer, exciting concept, in that we know we can improve our brain health. There's lots of things out there like Lumosity and brain games, and I just have to do a Sudoku a day, and I'm, going to help my brain. Yes, because what we know is to improve our cognitive reserve, we need to expose our brains to new things. So if all you're doing every day is brain games, not so great, right? We need to expose our brain to new ideas, new learning. That's where neuroplasticity happens, right? So anytime we do something that we've never done before, expose our brain to something new, we're going to improve our cognitive reserve. So this could be something like, if you love to cook, try a new recipe. If you play a guitar, learn a new song. If you don't play an instrument, maybe you want to start playing a new instrument, maybe learning a new language, maybe a puzzle, maybe a Sudoku, maybe reading a book, right? So these brain games are okay, but it's not something we want to do every day and the only thing we do. So we can definitely improve our cognitive reserve so that as our brain is being impacted by cancer and its treatment, it's not going to hit so hard because our cognitive reserve is higher. Another really important thing is exercise. There is so much research behind the benefits of exercise through cancer and its treatment on its own, and specifically also for cognition. So we know that exercise can help decrease inflammation, and that's very often what can be the cause of cognitive impairments with patients after cancer and its treatment, is that inflammation. So exercise is great in that respect. Nutrition. So eating a healthy diet, eating food and great nutrients, different green vegetables, any vegetables, staying away from those processed foods. So all of those things are really helpful in improving our cognitive reserve. So those are some of the things that you can do. Also, this is what I do for a living. I help people who have cognitive changes after cancer. There's lots of people. I work for a company called ReVital, who is based out of Select Medical. We're a nationwide company. There are therapists who are trained in specifically cancer and cognition, who can help you figure out all the difficulties you might be having, give you a thorough assessment, help you with some strategies to work around these difficulties, and also work to target these challenges that you're seeing. So one, there's a lot of things that you can do on your own to improve your cognitive reserve. But if you're really noticing that this is impacting your daily functioning, please reach out to your doctor, talk to your doctor about seeing a specialist who can help you work through some of these cognitive challenges that you're seeing.
I'm glad you touched on a couple pieces that we offer through our wellness program as well, which are super important. Erin, our registered dietitian, would have been super excited to hear you talk about that nutrition piece and also exercise. This isn't on our list of questions, but for those that are listening in, I think sometimes the word exercise might be a little bit intimidating if they aren't used to exercising, if it's not a part of their lifestyle. So, but we know that exercise can be a multitude of things. Could you give us some examples of how they might be able to exercise to help?
Yeah, absolutely. So first, I would say if you're somebody who has never exercised before, definitely start with talking to your doctor. But starting with a physical therapist who understands cancer and its treatment is a great place to start. They can really, gauge where you're at. They can take a look at your heart rate. They can take into account all of, any maybe joint pain, any peripheral neuropathy issues you might be having. They can take all these things into account to help you develop a really nice individualized program. So that would be my first recommendation. But absolutely, exercise can look very different for everybody. Some people just like to walk. walking is a great thing, right? So it doesn't have to, you don't have to be running. You don't have to be, it could just be going for a simple walk every day. If you like gardening, getting out of your house and doing some gardening, light housework can count as exercise. Great, using Apple Watches, those are great ways to just kind of start to monitor your heart rate, seeing if your heart rate's going up, getting up and moving, standing up more. These are all great ways that you can include exercise, sports activities. So there's multiple ways. Exercise does not have to just be running on a treadmill. I know personally, I hate treadmills. It's not my thing, but some people love them. So running might be your thing. Maybe strength training might be your thing. But my biggest recommendation would be starting with a physical therapist who understands cancer and the side effects of the treatment that can really help you, and you can work together to develop something. You don't have to come up with it all on your own.
That's a great suggestion. And I think that for those in our community that have heard presentations specifically from our yoga providers, they do a great job of explaining that anybody can do yoga. And so that's one of those things. We've seen comments from those in our community saying like, oh, I can't do yoga. And when they get a chance to see a presentation by one of our yoga providers, they show them it can be seated yoga, it can just be breath work, it can be some light stretching. And so like you're saying, there's something for everybody out there that can definitely help. So thank you for mentioning that. I want to take a look real quick into the chat. We do have a couple of comments. One question from Susan indirectly, does ReVital offer virtual services?
Absolutely. Yes, we do. Yeah, and that's a great place to start, because sometimes you might not have a therapist like directly in your area, but typically they should be in your state at least. But I've worked with patients who are so I'm from New Jersey, from the south end of New Jersey, because the clinicians have to be licensed in your state in order to work with you. But if you live in a state, there should be a therapist somewhere in your state who can help you. So yes, absolutely. ReVital definitely provides virtual therapy. And we can, if you need to, I believe Nina will be sharing our ReVital website. So you can go on the website, you can reach out, and we can help you get connected to a therapist in our area.
Thank you. And then Latoya mentioned she's noticed a big difference. She said she's in her late 30s and it's a little scary, but she's learned to give herself grace and time, which I love to hear. And she keeps a notebook with her to capture her thoughts, which is an excellent thing.
Perfect. Latoya is spot on. So using external aid, what we call external aids, but anytime you can help your brain and not have to hold on to all of that information. So we talked about that working memory before, using a notebook, writing more things down. Some people like to use their phones because they have their phones on them. Some people use planners. Everybody's different, but I would strongly recommend, and Latoya, you're spot on with this, that using a notebook or some way to help support your memory or help support that load so you're not holding on to so much is a great idea. Great idea.
Such a good idea.
And grace and time is perfectly placed, perfectly put.
Yeah. We hear so often, and I'm sure you do too, I think oftentimes those in our wellness program almost feel bad about having this chemo brain, quote unquote, and they apologize often for it. And that's why I think it's so important to discuss this, that there's no fault involved here.
Oh, I couldn't agree more, Nina. I think that's often said like, oh, I'm sorry, it's just my chemo brain. I'm sorry, it's just, well, no, this is a true side effect from cancer and its treatment. There is definite physical changes happening to your brain and your brain's ability to function the same way it used to. So by no means should be downplayed by anyone. And I'm hoping, the more that this gets out and the more information women hear and men hear, they'll be validated in knowing that this is something that is actually, definitely something that's legitimate and not something that should be downplayed, or definitely not something that's in your head or psychologically based either. Because that's something I often hear too. It's like, I'm being told it's in my head, or, oh, it'll pass. But this is something that really needs to be addressed and be put out there and normalized and validated for all these individuals who are going through these changes.
I like that word, normalized, because it's so true. And everybody experiences a little bit differently, like we said. So there's no one set description of it. There's no one set side effect. So it's different for everybody, and everybody has to allow themselves that grace, like LaToya had mentioned, for sure.
Yes.
So I'm going to pop my head back down to my notes here. And you had mentioned Alzheimer's a bit. So let's try and talk about that a little bit. So somebody asked, are they more at risk for Alzheimer's disease due to cancer and its treatments?
So that is another question. And sometimes people think I'm getting Alzheimer's because they're starting to notice these cognitive changes. So I'm happy to say right now in the research, there is no correlation between cancer-related cognitive decline and Alzheimer's. So there's no correlation that people who have difficulty with their cognition are more likely to get Alzheimer's disease. So there is no correlation. And no, this is not Alzheimer's disease. And if you're noticing these changes, it's important to know that that's not what's going on.
I'm sure that's a very scary thought, though, because they're dealing with their cancer diagnosis and now these side effects, and now their head starts going, well, could this be something else?
Yes, absolutely.
So important to recognize that they are very different.
That's a great question. I'm glad I was able to address that question, because it is something that's very scary and very realistic that people are concerned about. But there is no correlation, which is a really good thing to be able to say.
Yeah, certainly. So we tackled the Alzheimer's, and I'm going to pop my head back over here. So we were talking more about reminders. Sue actually had mentioned that she sets alarms constantly. I know we always put things in our calendars as reminders, and I set alerts for myself. So that's certainly helpful. Christina had mentioned she said, I love my CanPlan cancer planner to help keep track of my treatments, meds, and symptoms. So important. It's just, when you write things down, it's just so much easier, right?
Absolutely. And when you're going through, cancer and all the treatments and all the doctor's appointments and the changes in medications and when are you doing what, and not to mention everything that's happening every day in your life that isn't related to cancer and its treatment, if you have a place or a way to organize that information, I highly recommend it. So I think that's great. If you have a planner specific for your cancer and treatment, or a place to keep all your doctors' names and numbers and information. So when you're going to let's say you start going to therapy, you have everything in one place, right? So that's a great way to organize your information.
It is such a good idea. Susan had asked, do hormone blockers still cause chemo brain?
Yeah, so there is some correlation with some of the aromatase inhibitors and tamoxifen. So those medications who try and block or reduce the amount of estrogen that our body's making. Obviously, we're on those medications for a reason, in order to help prevent cancer reoccurrence. So that's the primary goal, and that's why they're important. But at the same time, estrogen does play a role in brain functioning. So when we're decreasing that estrogen, we are also decreasing the estrogen in our brain as well, which can impact cognition. Again, these are mild changes, and it's important to know that not everybody, if you're on hormone medications and you're not noticing any cognitive issues, it doesn't necessarily, that doesn't necessarily always correlate that if you're on hormone medications, you're going to have cognitive issues. But if you are noticing cognitive issues and you've been on some of these aromatase inhibitors, and sometimes, again, you're on them for 5 to 10 years, a long period of time, there can be some mild changes in your cognition noted.
Thank you. And I know somebody had popped in a question. They joined a little bit late. And so, Cynthia, please do let us know if we answered your question in regards to hormone treatment. But we did touch on a little bit earlier, is chemo brain associated only with patients who had chemotherapy or also related radiation? And it could be both, correct?
Yes, absolutely. Yeah, absolutely. We call it multifactorial. So many possible reasons that patients are noticing cognition. So not just, and this is why we're not using that term chemo brain anymore.
Thank you. Mm-hmm. So with all these things that, those who are listening in and anyone who's experiencing CRCD, they're probably thinking, we've talked about what can we do to help ourselves, but also how do they begin that conversation or educating family members and friends on the difficulties that they're having?
Yeah, so I know we had touched upon a little earlier that sometimes I've had patients tell me their caregivers are just like, oh, it's fine. It's all in your head, or I don't notice any difference. You seem fine. because it may not be so evident, because these are, again, mild changes. And although they're mild, you're noticing them and they're impacting your ability to function the same way you used to. So it's really important to start with resources. So this, and I think there was a question about whether or not this is going to be recorded. This will be recorded. Mm-hmm. There's other resources available as well. So starting with some of these resources so they can start to get a sense that in the research, we know that this is actually true. There are changes in our brain functioning, right? So I would start with those resources and then starting to talk about your difficulties. So not only relating it to, okay, yes, we know in the research this is actually true, but here's why I'm noticing differences. And this is not just because it's in my head or because I'm stressed, because that's the other one I think spouses say, oh, you're just stressed. You're just stressed out. No, it's not. It's not just that. And here's why. And having those conversations with a professional is another really great way to do it, because sometimes you need that objective third party to pop in and validate for you with a doctor or with a therapist that, yes, this is actually something related to cancer and its treatment.
I was going to use that exact word. It's probably very validating if it is acknowledged and somebody says, yes, this is what you're experiencing. It's not all in your head. These are the reasons why, and you can explain that to your friends and family. It must be very validating to that individual.
Oh, absolutely. And I think that term validation, I could say it a million times, but validation is probably, I think, the thing that most people get when they start to hear this information, just validated.
Yeah, exactly. I'm taking a look over at some of the chats that we have. Shannon shared that her husband had hormone suppression for prostate cancer years ago. She said he was frankly nuts. He finally stopped it. And now he's afraid that she's going to have some of the same side effects. She is on letrozole, Exgeva, and Ibrance for 6 months. And right now she's feeling pretty good, a few drop things. But, I'm sure that was a concern of his, it sounds like.
Yeah. So, we had talked a little bit about those aromatase inhibitors. I also think medication is constantly changing. And these targeted therapies are exactly that, more targeted. So some of the other medications that you mentioned, right? Ibrance for one, is we don't have research yet on whether or not Ibrance and some of those CDK inhibitors are necessarily correlated with cognitive impairments. Hormone medications, yes. But these medications are very different than they were a year ago. And they're going to look very different. So in men, hormone suppression is going to look very different than women as well. So I think that they're more sophisticated now. And I wouldn't anticipate, if you're not noticing any difficulties now, as long as you keep up your cognitive reserve, exercise, keep your brain stimulated, keep doing all the same things you're doing now, you're probably not going to notice more cognitive changes. Hopefully that makes you feel a bit better. And you could tell, Shannon, you could tell your husband, it's okay. I'll be okay.
And somebody else mentioned that they're about to go back to work. Their work specifically is very detailed. They're expected to be very accurate, and they have some concerns about that. So, is there a conversation that they could have with their employer? Is there a way that they could prepare themselves going back into the workforce?
So yeah, that's a great question. I think work is often a concern because work is where the demand is higher as opposed to, maybe being home, that you're have more attention to detail, more things you have to juggle, more information you have to hold on to. Disclosure to your employer is something that is a very personal thing. And some people feel very differently about it. Some people feel, I like telling my employer because then they're aware and they know what's going on. Other people feel that if I tell my employer, then there's going to be a spotlight on me all the time that I'm going to make mistakes. So it really comes down to personal preference and what you know about your employers. So that being said, this is where I would suggest getting in right before you start, thinking about some of those things that are going to weigh you down at work. So if you have a lot that you have to manage as far as to-dos, if you're somebody who I just remembered everything before, think about what system might work for you at work when you head back. How are you going to manage your to-dos? How are you going to manage all those things that used to weigh you down? Maybe you're going to start highlighting a little bit more. Maybe you're going to block some times for rest breaks throughout your day. So really thinking about your work day is, and how you can start to apply strategies to help mitigate some of those difficulties you may experience. And if you're back at work and you're noticing difficulty, I would suggest maybe pulling in a therapist, because this is what we do. We help kind of break down what your day looks like, what your job looks like, what your work looks like, and help apply strategies. So maybe you want to try this strategy for this thing. So that would be my suggestion, is if you can start to think about your work ahead of time, what that might look like, and what are some strategies you can put in place to reduce that cognitive load in any way you can while you're at work, including breaks for rest.
Such good suggestions. Thank you. Marianne mentioned, what about clumsiness? She's been on an aromatase inhibitor for 10 months and she feels very clumsy.
Yeah, so that I would suggest seeing a physical therapist. So because you could be noticing some balance issues, and that could be definitely correlated with cancer and its treatment. So that would be something I would talk to your doctor about. It could also be related to cognition, because if we're not focused, if we're not paying attention, we could bump into things a little bit more. So it could be both. It's hard to know unless you had a full assessment, but it could either be either one, but it definitely could be related to cancer and its treatment.
We had talked a little bit about this earlier, but how long does chemo brain last? And we've discussed it could last longer than some may anticipate. This one person mentioned that they're almost a year out of chemo now, and they're still having a horrible time recalling words and events, and it's very frustrating for them. I know we talked about some of the things that we can do, but is there a difference between what we can do while in treatment and then after treatment, or are they pretty much the same?
So yeah, they're pretty much the same. And I think, again, there's people who report cognitive changes years after. So I just, again, to normalize that, yes, you can notice cognitive changes like months to years after its treatment. So one, I would talk and focus in on strategies. So focus on your word finding. Some great ways to work it on your word finding. If you like crossword puzzles, there's a good way to work on pulling out words. Conversation. That's the best thing you can do for word finding, is have conversation, social communication with as many people as possible, because all you're doing is helping your brain pull things out, pull things out, pull things out. So those are some ways that you can work on that word finding issues. And then again, seeing a therapist, they can help you target some of those things specifically as well.
Thank you. I know we talked a little bit about the exercise piece to it, and we've had a couple comments in the chat about exercise. Marianne mentioned she's working on balance, so hopefully that will help. And somebody also mentioned Stronger Through Cancer, which is an organization that Unite for Her partners with. And it is offered through our wellness program. And Stronger Through Cancer is just that. So it's, basically the power of movement and exercising and meeting individuals where they are. So I'm happy that somebody mentioned that as well. Anybody can join that program who's been diagnosed with cancer, and they do work on things like balance and bone strengthening and sometimes just breath work and empowerment. And so that's a really great option as well.
That's fantastic. Sounds like a great program.
Yeah, so we just put that information in there. Can you think of anything else that the community might want to hear about CRCD? I think we covered most of our questions. And for everybody listening in, if you have any other questions, please do feel free to put them in that chat and we can talk about them.
I think we hit everything, but, I think the last thing I just want to bring home is that this is going to look different for everybody. As we mentioned, everyone's brain is different. Everybody's different. So you figuring out your own strategies and ways that are going to help you is going to look very different than maybe somebody else who's also noticing cognitive changes. So it's individualized. It needs to be highlighted. And I hope you feel validated in knowing that, yes, this is something that is clearly related to cancer and its treatment. It's not in your head. And there is help you can get. So this isn't something that you just have to live with and just deal with. And it's just my chemo brain. There's something that you can do to work on it. Lots of things you can do. So hopefully everyone got that message through this presentation. And I'm happy to reach out. I'm happy to answer any questions. You can reach us through the ReVital cancer website. If you're looking for therapists, we can help make that connection as well.
And I think, going back again to LaToya's comment, I think just be kind to yourself and be patient and allow yourself, this time. And Catherine put a question in there. I think this is great. I'm surprised we didn't think about this earlier. She said, is there something quick and easy she can say when she's interacting with strangers and she can't find the words that she's looking for without giving them her medical history? What can she say?
Yeah, that's such a good question. And I think it's going to be dependent on your personality. I've worked with patients who have a certain sense of humor, so they make a joke out of it. Other people are very serious about it. The thing about word finding is that the person who's having the word finding issues is more likely to notice it than the person you're having a conversation with. So what I often tell people is when you're stuck, just start describing the word. You don't need to disclose to everybody that I have word finding issues because I've been through cancer and its treatment, to your point, Catherine, right? So it could just be that when you're having word finding issues, start to describe the word. And what you'll notice in conversation typically is that people will just kind of give you the word and then your conversation can keep flowing. Or sometimes by describing the word, you start to find it. If you start to point out, oh, I'm having word finding. Oh, there's my word finding issue. Oh, there's my word finding issue. It's almost always that word stays stuck. That word will not come out. So start by describing it. That would be my best advice for you. As far as if you're having other difficulties and you feel the need to disclose, then you can you can either make a joke about it. You can make it very, very concrete and I'm sorry, I just have a little bit of word finding issues. And then just keep going from there. You don't need to tell them your whole history by no means.
Thank you. Oh, I like that. Susan said, I tell my husband not to tell me the word so I can force my brain to find it.
So, and that is a preference thing. And this is why we go back to everybody's different. Some people say, give me the word, because I've had other people who their husbands or their significant other make everything a therapy task. No, I'm going to make you find the word. And then you're trying to have a conversation and there goes the conversation because it just turned into a therapy session. So sometimes it's okay to just have someone give you the word if it means the conversation is going to keep flowing. But if you're somebody who likes to, no, that's something I want to work on, I want to work towards, and you feel comfortable with whoever it is, maybe your husband is the one that you do that with. Okay, when I'm stuck, just give me some time and I'm going to see if I can get the word, or I'm going to start to describe it. And I would still suggest you describe it, even if you want to be the one to pull the word out, because that's going to help your brain start to process and pull those words out a little bit better.
That's so interesting. Thank you. And I do want to mention also before I forget that you did a speaker series with us as well. And anyone can access any of our past speaker series on our website. And if we can throw the link into the chat, I can. If not, it's uniteforher.org/her library. And you can go see our past Ask the Experts. So this event's recorded and will be there, as well as our speaker series where Erica was a part of as well. And so you can take a look at those there. I do also want to mention Ask the Experts, once again, is a part of our digital education series. And this one specifically is supported by our 2022 education sponsors and presented by Merck today. And each of our Ask the Experts is held on the last Thursday of each month, and it's streamed live on Facebook beginning at 1 o'clock Eastern. Our next episode coming up is going to be Thursday, June 30th. We'll have some more details coming up for you on what that topic will be. If you need any additional information, would like any additional information on ReVital, we can throw the link in the chat there. Of course, if you would like to reach out to one of us at Unite for Her, you certainly can. You're already probably on our Facebook page right now and can be a part of the community. If you think of any questions afterward, Erica, I'm sure I can send you an email and check in with you.
Absolutely. Yes.
Thank you so much. Susan said, thank you for all you do. Erica, I really appreciate your time today. I think it's such an important topic. We hear, like I had mentioned earlier, so often from those in our wellness program that they're experiencing this, and it's very frustrating. So I think the tools that you gave them, the suggestions that you had on how they can help themselves as well work through some of those things, being patient with themselves, it's also valuable. So thank you so much. I appreciate it.
I am happy to be here. I'm happy to help educate and spread the word. I think it's such an important topic and such an important thing that we need to spread more. We just need to get this word out more.
Absolutely. Well, thank you all for joining us. I hope that you got something out of it, and we look forward to the next one. Take care.